What if I told you you could lower your blood pressure without running, without hitting the gym, or even without moving? Sounds too good to be true, right? But it's not. Recent scientific studies have discovered that a certain kind of exercise, one that doesn't even involve movement, can significantly lower your blood pressure. All it takes is a few minutes per day. And the best part, you can do it at your home without any equipment in your free time. In today's video, I'm going to break down this research about why isometric exercises have proven to be very helpful in reducing blood pressure. So if you know someone who already has blood pressure or wants to prevent it, then make sure you watch this video till the end. So first, let's understand the basics. What is blood pressure? So blood pressure is literally the force that is exerted on your arteries due to the pumping action of the heart. And that is how blood is delivered to all the organs in your body. But when the blood pressure remains consistently high, then it can end up damaging those same organs. It may be your heart, your brain, your kidney, or even your legs. High blood pressure or hypertension is often called as the silent killer because most of the times it may not produce any symptoms like headache or nausea or vomiting. In India alone, more than 220 million people are probably suffering from hypertension or high blood pressure, and 50% of them do not even know about it. And you must have heard the advice: eat less salt, exercise regularly, take these medicines and keep your blood pressure under control, reduce your stress. These are all very common advice that we keep hearing day to day. But let me tell you a shortcut, something which is not so commonly advised nowadays. And if you like my videos, please don't forget to subscribe to my channel. Now let us understand the research behind exercise and blood pressure. We all know that exercise can really help to reduce the blood pressure. But a very recent meta-analysis, which was published in the British Journal of Sports Medicine, showed that different exercises have different impact on lowering the blood pressure. So this study was published in 2023, and because it was a meta-analysis, it could analyze more than 15,000 people or patients with high blood pressure who were undergone into certain different groups of exercise that they were doing. So in this study, all the people were compared using 4 different kinds of training methods. The first was aerobic exercises like running and walking. The second was resistance training, which would be mainly weightlifting or lifting weights. The third was a combination of both. And fourth, the last one, was isometric muscle exercises. Now, isometric muscle exercises are those exercises where you hold the muscle in a particular position. You hold it tight without moving or changing the position. So this was the fourth category of people who were really compared to. And now, here's the shocker. Did you know which group did the best amongst all? While earlier research has shown that all these exercises do help to reduce the blood pressure, it was the fourth category, the isometric exercises, which had been proven to be most effective in reducing blood pressure. That's right, not running, not walking, but just doing these isometric exercises. And out of all the isometric exercises, wall sits was proven to be the winner. And a very close second was the plank position. So these 2 isometric exercises have been now proven to be probably more effective than the walking that you regularly go for. So make sure you incorporate any one or both if possible into your daily fitness regime. So now let us understand what are wall sits and how are they done. And we will also show you a demonstration of the same. So you can be standing with your back against a wall. With your back supported against the wall, slowly slide down as if you're trying to sit in an invisible chair. There's no chair. You have to be against the wall. Your back is against the wall. Lower yourself till your knees reach a 90-degree position. It's a difficult one to start with, especially if you haven't done it before. If you feel that it's easy, then maybe you can hold on for a period of 35 to 60 minutes. In this position, try and keep your knees at 90 degrees so that the thigh is parallel to the ground. And in this position, hold your muscles, mainly your thigh muscles, your abdominal muscles, when you hold them, that gives the maximum benefit of being an isometric exercise. But remember, it's the muscle that you have to hold and not your breath. Breathe normally while you're doing this position. It's not an active exercise, it's a passive exercise in which you're just holding the muscle. Now, if you find that keeping the knee at 90 degree is difficult to start with, maybe start off with a smaller degree of angle. Maybe the knee can be at 100 degree or 120 degrees, and then gradually you can build upon it. Even the duration to start with can be as low as 30 seconds, but try and improve and increase that to 60 seconds or even more. So this might sound too easy, but believe me, when you do it, it's not that easy. And why does it work in the first place? Because when you hold yourself in a particular position, your muscles are all contracted and working. They're not working by changing the length, but they're definitely working from inside. And that contraction will improve the amount of blood flow that is there in the vessel. And when you release it, that release gives rise to relaxation of blood pressure. That contraction will improve the vessel tone. And when you release the contraction, that release is what will improve the vascular tone, reduce what is called as the peripheral vascular resistance, and hence leads to a reduction in the blood pressure. Now let's talk numbers. When I say reduction in blood pressure, how much reduction are we really going to get? So these studies have shown that by doing isometric exercises, your systolic blood pressure, the higher one, will reduce by 8 to 10 millimeters of mercury, while the diastolic blood pressure, which is the lower reading, will reduce by 4 to 6 millimeters of mercury. Now you may think that's so less, but let me tell you a fact. A 10-point drop in your systolic blood pressure can reduce the risk of strokes by almost 20% and reduce the risk of heart problems by almost 40%. Yes. So even a smaller reduction will have a bigger gain for you. And what's more interesting, it's not those people who have high blood pressure who benefit. It's even those who do not want to have high blood pressure. So it is good even as a preventive exercise. If you have a family history of someone with high blood pressure, make sure you do these exercises regularly and you might be able to avoid that. But remember, this is not an alternative to medical treatment. These exercises should always be done taking your main doctor, your main physician or cardiologist into confidence. And remember, do not forget to take your regular daily blood pressure medicines. Now, one question which probably you would have is, why does this work better than walking? Because for years we thought that walking is probably the best exercise that you can do. So rest of the other forms of exercises, be it walking, running, jogging, cycling, swimming, or even the strength exercises that we always talk about, they are all exercises in motion. So the muscles are constantly moving. They are not static. So while they definitely help in improving the overall blood flow, when we talk of reducing blood pressure, it is important that there is reduction in overall peripheral vascular resistance. That's the resistance inside those smaller blood vessels, which is reduced because when you really contract hard and then you release, that release is what gives rise to the benefit. So that is the reason that isometric exercises have shown to be better as compared to the rest of the other exercises. But that doesn't mean that you don't do the others too. The other exercises have a lot of different benefits, ranging from improvement in circulation to your cardiorespiratory health as well. Muscle fitness also is very important if you want to keep your muscles and your body younger. So remember, doing only isometric exercises is not what we are really telling you. You must have a combination of all. And the other good part about this exercise is that you can do it indoors at your own convenient time. You do not need any equipment. And because there's no bouncing or impact, they are easy on your joints as well. Some people might find it difficult initially, but believe me, when you get used to doing it, your muscles will also feel the strength in it. And that strength also helps in improving the overall posture that you have when you're sitting, standing, or even while walking. So wall sits are actually a type of squats. So who should take care or precautions while doing these exercises? The first is someone who already has an existing joint injury. Second, someone who has a severe degree of osteoarthritis of the knee. So knee arthritis people may find difficult to maintain that position. Thirdly, balance problem. Not everybody can do this so easily. So please try it out with a lesser degree of angle, and then if suitable to you, move on to the correct 90-degree angle. And at the end, I will always tell you that exercises are an addition to medical treatment. Medical treatment and regular monitoring is the key when it comes to blood pressure, because no matter how frequently you do any exercise, some people will have the need for medicines and regular monitoring. Do not skip any of these. And if you have reached so far, that means that you like our content, and you might find that these anti-aging exercises will really benefit you if you want to stay younger and stronger.